Well, welcome back again to another installment of this great conversation that I've been having with business leaders around the impacts on mental health that this pandemic has caused. With me today is James Hadlock. He calls himself the Chief Evangelist for BluNovus, and a wonderful organization that I'm learning more about. And he is definitely on the front lines of this issue. He also has a very interesting approach to not only mental health, but the culture of an organization, and this being a culture issue. And I'll let him talk about that a little more. But thank you so much, James, for taking some time to be with me today.
Oh, absolutely. My pleasure.
So tell me a little bit about, I know you're working, like I said, on the front lines with a lot of organizations and companies. What have you seen the changes that the pandemic has caused in workforces?
You know, I think it's very obvious with a lot of the initiatives out there around social distancing and self-quarantine. Most of the companies that we work with and those that we recognize and know here in our community, you know, remote work is where everybody has gone to. And it's interesting because that's brought up some new issues, you know, from a managerial standpoint. How do I support my teams when I don't know what they're doing?
Right.
It's been really interesting, which I think has elevated people's emotional state. I think people feel a little bit more on edge, not just because of the COVID-19 virus, but just the state of how work is today.
So you told me a little bit about your organization, and I wouldn't say that we would just throw you in the bucket of an EAP. So tell us a little more about the role that your organization is playing. Typically, I've been asking business leaders about what role an EAP has played during this time, but tell me the work that you're doing for your clients and for companies to help them manage through some of these anxiety and mental health issues that are coming through.
Yeah, I think there were two stats that really stood out to us when we created BluNovus several years ago, and it was that 90% of the people in the United States that live with a substance use disorder and 80% of the people that live with mental illness will never reach out and get the help that they need.
Yeah.
So when you think about that trickle-down effect and whether they end up finding services for themselves or utilize an EAP, you're literally only getting a very small percentage. You're getting just a few of those people. And when we looked at it, and with my background with both navigating mental illness and substance use disorders myself and working in the behavioral health space for as long as I had, I mean, it was evident to us that we had to figure out how to go upstream and to be more proactive. And so when you think about utilization in the traditional sense, it's very low. Almost nobody reaches out to get the help that they need.
Right.
And yet so many people suffer. And so we asked ourselves why. And the statistics are very clear and consistent. The number one reason that people don't ever reach out to get help is stigma and job concern. So that immediately points to the environment of an organization. Right? It points to how much have we normalized the conversation? How willing are we to talk about it? How have we created the kind of environment where it feels safe for people? And that doesn't mean that we expect people to walk into the HR office and tell them that they're struggling. But if you understand the dynamic of how we navigate these issues, if you could normalize the conversation in your company, you immediately would send the message that people are okay reaching out and getting the help that they need. So
Right.
We wanted to tackle that 90% and the 80% that never reach out and get the help.
Gotcha.
And that comes down to managers. It comes absolutely down to the supervisors of your organization. So even though we've taken almost this one by one approach to helping people when it comes to mental health and addiction in the workplace, it's really the culture of an organization that's going to address this more effectively.
Okay, well, that's great. And I love that approach. I mean, the idea that you're focused on the culture of an organization as opposed to the problem. And so that takes me to the next question, is leadership. And so maybe you could help us understand what what that leadership looks like that wants to do it that way and wants to engage on that level. I mean, you probably have leaders that are oblivious to it, and those are harder to evangelize and turn around. But tell me what the leadership looks like that is behind the effort that the road that you're traveling down.
Yeah, well, I think first to identify what some of the most common responses we get from HR leaders talking about their own managers and supervisors is, one, they're super uncomfortable to talk about it. They don't, they have a lot of fear around, what if somebody comes to me and says, hey, I've been diagnosed with X. So there is, in fact, the National Safety Survey back in 2017, in interviewing HR leaders and CEOs around the country, they came to discover that 87% of those leaders feel ill-equipped to address mental health and addiction in the workplace. Wow. 87%. Mm-hmm. And so typically the responses we're getting from HR on how they're addressing it is there's no empathy, there's no understanding, managers feel uncomfortable, and so typically they either ignore it, or they show up even worse, they don't create a very welcoming environment for someone to open up the conversation. And so you know what the ultimate thing that happens?
What's that?
They end up letting that employee go. They end up firing them.
Yeah.
It's the number one way that we address mental health and addiction in the workplace today.
Okay.
So we may see an employee and then we notice, oh, they're not showing up on time, or they're not fulfilling kind of their whatever the agreement is with the organization. And so they're deemed this bad employee. They're disengaged, they're disgruntled, and all too often we forget to look underneath the behavior. And because we've created a culture where I've got to keep it secret, I've got to be quiet about it, ultimately we end up letting them go, or they end up leaving because they feel misunderstood, or they feel embarrassed themselves. That shame and guilt is so big. Mm-hmm. And so to answer, the solution is to prepare your managers, and you don't have to train them necessarily in all the ins and outs of mental health. The most important thing to understand is if you can create the kind of environment where they feel safe. So this is why it's culture. Right. Because everything I'm talking about now is stuff you hear in leadership trainings. Learn how to build trust, learn how to communicate, learn how to listen, learn how to just be there for somebody. Mm-hmm. And I'm just telling you, there is such a correlation between the best leadership skills and creating a culture where people feel safe enough to get the help that they need. And the good news is it's something that anybody can start to adopt today.
Yeah. I love the idea of forming an environment where they're open and available to have the conversation, as opposed to giving them a sticker with a 1-800 number on it.
Yeah. Right? So so that is not an approach to mental health. That's an approach to just good leadership practices.
Right.
Right.
Yeah.
And this is forcing us to really look at, I think, those leadership skills and those soft skills, as some might say, a little bit differently, and the importance of really walking that walk.
Yep. I posted a video the other day about blessings or good news, whatever you want to call it, wherever it comes from for you, but the good things that are coming out of this. And your approach and these conversations are certainly, I would say, falls in that category. So thank you so much for taking some time today. I greatly appreciate it. I'm excited and encouraged by your approach that you're taking. And what's the best way to reach you if someone wants to connect with you?
Yeah, so really easy. They can go to our website at www.BluNovus.com, and that is spelled BluNovus.
Perfect. Okay, great. Thank you so much for your time, and have a great day.
Yeah, thank you. Appreciate it. Take care.
Bye-bye.